Good afternoon, everyone. Today we want to explain or to do a little bit interpretation or clarification and X-ray or how to interpret X-ray. So before we go how to interpret X-ray can be done in BA, posterior anterior, or AB, which is anterior posterior. We will see the difference between posterior anterior and anterior posterior. But in imagical aspect, how can we differentiate this? This a BA or this an AB? So in this X-ray, we have a, on the right, in this side, we have a BA X-ray, and here we have an AB X-ray. There are other view, like a lateral view or lateral view, but today we will just explain only the difference between BA and AB. So here, let's explain how can you differentiate between those two, BA and AB. So here this is an BA X-ray and this is a AB X-ray. How can we differentiate? So if you look on BA X-ray, you can see since the patient is standing, usually BA X-ray or posterior anterior X-ray, the patient is standing, so you can see the gas bubbles on the left side below the left hemidiaphragm. So this is a left hemidiaphragm. So below the left hemidiaphragm, you can see the gas bubbles. So that's the stomach bubbles. So when you see the air fluid level or gas bubbles on the left hemidiaphragm, that's indicating the image was done on BA X-ray. Again, if you look the heart shadow, this is the heart shadow. On your left side of the X-ray, you can see the shadow. So usually 2/3 of the heart should be on the left side of the spine. This is the spine vertebra. So 2/3 of the heart should be on the left side, and usually 1/3 of the heart is on the right side of the spine. So if you look this heart shadow here, it's small comparing it to the heart shadow on AB, because AB, the source of X-ray is very close. And the X-ray is close to the heart, so the heart shadow is big in AB, while in heart shadow it's small or acceptable in BA X-ray. So that's other difference. In BA X-ray, the heart shadow is small, while in AB X-ray, the heart shadow is big. Second thing, on BA X-ray, the patient did a good inspiration. So you can see the right hemidiaphragm here. So this is a right hemidiaphragm. I don't know if you can see this, the right hemidiaphragm. So the right hemidiaphragm is a good place in BA X-ray because the patient take good inspiration. So the right hemidiaphragm usually it's around 9 or 10 posterior ribs. So you can see it's a good inspiration. And here you can see the left hemidiaphragm also, there's a good inspiration. But when the patient is sick and the patient lie in supine position and we take the X-ray, the patient cannot do good inspiration while the patient in a supine position. So we are expecting less air or low inspiration in AB X-ray since the patient is sick. So you can see the hemidiaphragm is, right hemidiaphragm is high level comparing it to the BA X-ray. So you can see the BA X-ray, the right hemidiaphragm in a good position, while here in AB X-ray you can see the right hemidiaphragm is high up because there is no more air and there is no, the hemidiaphragm are not pushed down, so there is no inspiration, good inspiration. That's another difference. So the AB X-ray, the hemidiaphragm are high, while BA X-ray or posterior anterior X-ray, you can see hemidiaphragms are good in location. The other difference in BA X-ray, the lung or vessels in the lung, like the vascularity of the lung, are more on the lower lobes of the lung, especially they are more common in right lower lobe zones. Here you can see right lower lobe, here there is a more vascularity, and you can see also some vascularity in the lower zones on both sides. But when you look in AB X-ray, the vascularity it's more prominent, on the upper zones. You can see here and you can see here. So also that's a difference. So you can look the vascularity, which is more prominent in the lower zones in BA X-ray and AB X-ray. Their vascularity are more in the upper zones. Let's see another difference. In BA X-ray, the clavicles are more horizontal. If you can see here, you can see the clavicles are more horizontal in BA X-ray, while AB X-ray, the clavicles are more somehow vertical. So you can see here they are vertical comparing to the posterior anterior X-ray or BA X-ray. The other difference which you might see is the clavicle, is the scapula. So you can see this the shadow of the scapula, but you can see somehow the scapula shadow is still you can visualize inside of the lung fields. But in BA X-ray, the scapula shadow is away from the lung fields. It's not like this one here. You can see too much scapula shadow inside the lung fields, but here you can see a little bit, which is a more peripheral regions. So that's the difference you can do. Also, one more thing I want to add here, in vertebra or the bones here, can you see this there? Thoracic spine or thoracic vertebra and lumbar vertebra, they are more prominent or they are more clear in AB X-ray. But if you look here in BA X-ray, the vertebral shadow or the bones are not more clear. They are not clear like in AB X-ray. So all these things are the difference you can see in between the BA X-ray and AB X-ray. And that's one difference. So if you want to look again and to explain, to understand well, in BA X-ray, the source is from the posterior of the patient. So these are the receptor you can see here, but the source of the X-ray is posterior from the patient, while in AB X-ray, the source of the X-ray or the X-ray machine, it's anterior to the patient. So it's anterior of the patient, while here the source of X-ray is the posterior to the patient. So this is a posterior anterior, so BA X-ray, and it's from anterior to posterior, so it is a AB X-ray. So normally if the patient is sick and he can't stand up, we use an AP X-ray. And again, AP X-ray, it's the patient, it's sick and he can't stand up. And most of the machines which are portable X-rays, they are in AP X-ray. B X-ray, usually the patient, they can stand. And you can see the heart magnification, it's normal because it's far away from the source of X-ray. While in AP X-ray, the source or the X-ray is more close to the heart, and so there will be a magnification of the heart in AP X-ray. Yes, so the next session will explain how to read in X-ray what's the normal and what's abnormal, but this session we want to explain only the difference between AB X-ray and BA X-ray. So don't forget to watch the second part of this session. Thank you.